Hello, I'm Brian Haug, President of the American Journal of Managed Care.
And I'm Justin Gallagher, Associate Publisher.
Welcome to This Week in Managed Care from the Managed Markets News Network. This week's top story comes from Bristol-Myers Squibb, the developer of nivolumab. BMS announced this week that an independent data monitoring committee stopped the Phase 3 Checkmate 025 trial early because patients receiving nivolumab experienced significantly better overall survival compared with the control. The trial evaluated nivolumab versus everolimus in previously treated renal cell carcinoma patients. BMS officials said this was the first time an immuno-oncology agent showed a survival advantage in renal cell carcinoma, a patient group that currently has limited treatment options.
More trial news came from ASCO, which this week called for federal agencies and the research community to include more geriatric adults in clinical trials. Because so few trials include older patients, oncologists lack toxicity data and knowledge on how new therapies will work with older patients. Said ASCO President Dr. Julie Vose, older patients living with cancer have different experiences and outcomes in their treatment than younger cancer patients. Older adults must be involved in clinical trials so we can learn the best way to treat older cancer patients, resulting in improved outcomes and manageable toxicity. Paying for cancer therapy is a challenge for many patients, and the Patient Access Network Foundation works to help patients and families meet the rising cost of cancer care. PAN Foundation President CEO Dan Klein spoke recently with AJMC about the group's mission.
The biggest role that PAN plays is to eliminate the financial barriers that, one, prevent patients from initiating treatment in a timely fashion, and two, that make it difficult for patients to stay on and complete treatment. So by eliminating the deductibles and the copays for patients who are using specialty medications in particular, PAN has really, I think, encouraged patients to stay on therapy and hopefully be more successful with their therapies.
You can learn about the partnership between AJMC and the PAN Foundation, along with the PAN Challenge at ajmc.com.
Cancer and other diseases that may require palliative care will be part of a test program at CMS, which will allow a select group of hospices to let Medicare patients receive coverage for both curative and hospice care. Because Medicare traditionally will not cover both at the same time, fewer than half of patients select hospice, and then only for short periods. This policy was criticized last year in a report from the Institute of Medicine for discouraging palliative care. This week, Health and Human Services Secretary Sylvia Burwell announced that 140 hospices will take part in the program, which could help up to 150,000 patients with cancer, HIV, congestive heart failure, and other diseases.
Midway into the second year of Medicaid expansion under the Affordable Care Act, many states that embrace this option are finding out that more people signed up than they planned. That might prove costly in 2017 when states start paying 10% of the cost of expansion. In Kentucky, for example, the number of enrollees that signed up for Medicaid expansion was twice the projection at nearly 311,000. And the projected costs for 2017 have climbed from $33 million to $74 million. Lawmakers in many states fear Medicaid costs will crowd out funds for schools or transportation.
Finally, this week, Evidence-Based Diabetes Management features an interview with Dr. Stephen Miller of Express Scripts, who says that the social contract, which once kept drug prices in check, is now broken. Drug companies and Wall Street, he said, clearly believe that if you have a unique therapy and if you have the patent, then you have almost unlimited pricing power. For the full interview and for what's new in technology and diabetes care, visit ajmc.com.
For the Managed Markets News Network, I'm Justin Gallagher.
And I'm Brian Haug. Thanks for joining us.